Yeah, thanks very, very much, Sakina. And in fact, to have a look and quote what the ANC President Cyril Ramaphosa was saying about the rollout is that he admitted that it has been too slow. So let's just continue questioning Professor Alex van den Heever and get his opinions on the vaccine, where we're at, and also dangers of South Africa entering into that second wave. And Professor is Chairperson of the Social Security Systems Administration and Management Studies at Wits School of Governance. So, Prof, we hear the President last night talking to the fact that the ANC are very unhappy with the pace at which the vaccine rollout is happening. But, I mean, let's be honest. Who's responsible for that at the end of the day? We had 1.5 million vaccines in the country from AstraZeneca. That was proved to not be the preferred choice. We then have as you say, it's not even the rollout that has begun. We've got trials still taking place for Johnson & Johnson, and there genuinely is no rollout. I mean, governments are responsible for this right now. So what was your response to hearing the ANC saying that they're disappointed at the rollout?
Yeah, it's unclear what the decision-making is within government, but the direct responsibility lies with the Minister of Health. And in the case of the AstraZeneca vaccine, they potentially had access to up to 3 million doses. Now, Johnson & Johnson on the sort of the trial information shows that it's a very good vaccine for South Africa, and it's also a single-dose vaccine. So that is very good for our context. But nevertheless, if we had 3 million doses available, which would cover 1.5 million people, it would have been better to actually administer that, even if we would have to vaccinate many of the people with, for instance, Johnson & Johnson or another vaccine, to give added protection to people. So it seems that we really missed an opportunity to deploy that, as well as to test our rollout structures, an expanded framework to get our rate of vaccinations per day up beyond the trial. So it's very unclear from quite a lot of people as to why, in fact, we just did nothing and then gave the vaccines away.
Yeah, I mean, let me quote, because at least I've got the statement in front of me, so I can speak with more authority. What the President said yesterday was the meeting agreed that the vaccination program needs to be significantly accelerated and scaled up. The NEC called on all relevant government entities to work with social partners and other stakeholders to urgently procure, distribute and administer sufficient vaccine doses to meet the country's needs. Working with other countries on our continent and in the developing world, South Africa should intensify its campaign against vaccine nationalism. So that's what the President had to say about that. But, you know, there's been a lot of calls from the private sector to want to get involved, to want to try and assist where they can. Do you think that this is something that we should be looking into?
I think that there have been discussions to sort of look at appropriate cooperation between the public and the private sector. In speaking to individuals from the sort of business side, they have been absolutely champing at the bit to get going and to do stuff, and they have quite significant capability. There are also quite large industries, like the mining industry, for instance, who could have run their own vaccination program for both their employees and the families of their employees. We have industries that are very vulnerable, like the hospitality industry, who could also drive a program as well. So those are industries as opposed to the health industry itself, which is clearly quite capable of running a very good vaccination program. So we just haven't been allowed off the starting block, so to speak. Now, government it indicated that it wanted to be the sole procurer, sole distributor of vaccines in South Africa, and the problem was that it then seemed to do nothing with that authority. I think that what may have happened now is, huge pressure is on government to get going, and I think at the level of the President, there's been an intervention to kind of get these agreements going, because it appears as though there have been sort of odd bumblings and stumblings within the Ministry of Health, and some of those have now been removed, but we still have an enormous amount to do, and it's unclear where we are. The rollout strategy should have been finalized about September in 2020, not now. Yeah. But now we have to work with where we are.
Yeah, I mean, we've lost a lot of time, and that, the government kept saying it was the new strain that was the variant that was found here in South Africa that was hampering it, and they didn't want to commit, and then because of they weren't sure if the efficacy of the vaccines that had already been developed were going to act well against the new variant. Is this a good enough excuse?
No, not at all, because certainly one of the very strong probabilities, although not absolutely certain within the South African context, is that, for instance, the AstraZeneca vaccine would provide protection against severe illness and death. And if that's the case, everybody that gets vaccinated, let's say from March to April, which we could have done, would be protected against any kind of surge or wave, even if it doesn't completely protect against infections. So we could have actually done that by now, but what's clear is that we will only be vaccinating probably from toward the end of April. So during this entire period, a whole lot of people who are at risk of severe illness could have been vaccinated. So this is the concern. The United Kingdom took a day after the South African results came out to say we're going to continue our rollout of AstraZeneca, even though the sort of so-called South African variant was present in the UK as well. And their assumption was that it will protect against severe illness. WHO said the same. Europe has continued vaccinating with AstraZeneca. So although there are concerns about full efficacy of that vaccine, when faced with nothing versus that vaccine, you go ahead and then you revaccinate. It's a small amount of money in comparison to the amount of damage that's done if a large number of people die or have to go to hospital because we haven't protected them.
Yeah, and that's the reality. So I'm assuming you think we should have gone ahead with those vaccines, those 1.5 million vaccines, that there was such a hoo-ha that arrived in the country and then that was put on halt, and we've now apparently sold them off to the African Union. You believe we should have used them?
We should have used them, and we potentially had up to 3 million available to us from AstraZeneca, and that would have filled this time gap.
Yeah.
And it was also not certain that this Johnson & Johnson rollout that's been apparently agreed was going to happen as well, because Johnson & Johnson was saying earlier on in the year we're going to export the lot. So I think that there has been a push to try and do something, but we were actually facing a situation where we would have no vaccines, neither AstraZeneca nor Johnson & Johnson, right up until the second half of this year.
Prof, what do you think we need to do to slow down this third wave? The reality is that in our arsenal, that's what we keep on being told, we have masks, sanitizers, hand washing, and the ability to social distance. That's what we have been told to do, and a lot of people are, but many aren't. And people are going back to their ways. COVID fatigue is something that a lot of people are going through. But the reality is that it is still with us. We have a very few amount of people that have been vaccinated. How do we prevent this third wave, or at least slow the third wave down?
So I think the experience that we've had in South Africa and what we're seeing elsewhere is that it is the super spreading events that drive the big surges, drive the big waves. And so those are the instances where the greatest caution is required. So if you've got like 1,000 people coming together in a single indoor setting, you really are going to drive another wave. It's also important to note that large parts of the economy were left open when the sort of level 3 restrictions were introduced on the 27th of December, and yet we didn't have accelerating transmission over that period. So the restrictions that were introduced definitely did impact on super spreading events, and that tells us very clearly that that is the way that we need to go. So I think that really our risk lies in managing those particular contexts, and we could actually target them in some instances, and there are some high-risk events during this period that we need to look at very, very carefully. But certainly the large religious gatherings people need to exercise a huge amount of caution when you go into a very large gathering like that.
Yeah.
But I think that general religious gatherings, people have been very cautious. Churches have been open and they haven't been driving super spreading because they have been observing protocols.
Yeah, it'll be very interesting to see, because we do know that the Command Council are meeting today, so we'll see what the outcomes are. A lot of religious institutions are asking for the ability to have more crowds, but we'll see what comes in there. I just want to start wrapping it up, and quite interestingly, I know that there was a big webinar. You were a speaker at this webinar, and you had a lot to say. A lot of what we've been speaking about, you spoke at it. But a bit earlier in the interview, when I didn't quite ask you who should be held liable for the situation we find ourselves in, you kind of did mention the health minister. Let's stop there for a second. Everywhere around the world, there have obviously been a lot of anger from different sections in society saying that their government hasn't done enough. There's been a lot of disappointment with politicians. But let's focus here in South Africa. We are in a situation that we were hoping we would not be in. I mean, this time last year we were told to stay home so we could start preparing. I'm not sure that we did enough, because here we are a year later, and I'm not saying we actually are not better off. Who should be held responsible? You even spoke of somebody should be fired and not just one person.
Yeah, I think that a lot of people have dropped the ball here, and typically in most democratic societies, the Minister of Health would be held accountable for failures of this magnitude, and I think this is a very significant failure. We are bumbling forward and getting stuff going, but it's largely despite the Ministry of Health. So I think that the Minister of Health has to be held accountable, and I think that the top administration, the top management of the Department of Health have to be examined very closely, because they are part of advising on what should happen. They are part of taking proactive action. And consistently the message that we get after we've got these huge mistakes is, oh, well, with perfect hindsight. The reality is a lot of the mistakes that have been made could have been foreseen, and they haven't. So the vaccine strategy being really the final debacle in this situation, because it was so obvious that our vaccine strategy had to be developed well in advance, and that our arrangements had to be put in place by September last year. And a lot of people thought they were. It's just, you just assumed government was getting on with this. Mm. And then you discover in late October, November, nothing has happened.
Yeah. I mean, we haven't even been a beneficiary of COVAX, and that's all we kept on hearing was COVAX, COVAX, COVAX. And I mean, as far as I know, we haven't had any COVAX vaccines arrive in the country.
And COVAX it will be relying in the sort of initial stages substantially on AstraZeneca. And we've just decided we're not going to use AstraZeneca at all. So again, we will not benefit from the distribution of AstraZeneca, although they will obtain vaccines from Johnson & Johnson and have got from Pfizer. But it's far from clear when we will get any significant allocations out of that arrangement. And I think that, it's a high risk to rely on a global arrangement that hasn't been tested before. Yeah. So it's going to have teething problems. I think for the next pandemic, something like COVAX will be better organized. But it's clearly something that an arrangement that will experience a lot of teething problems. And it would be insane to rely on that as our only strategy.
Professor Alex van der Heever, thank you very, very much for talking to us here on the program. Lots discussed here. Continue to send your views and comments if you'd like to. And the professor is both a health economics and finance specialist from the Wits School of Governance, sharing his views on the rollout of COVID-19 vaccines, or the lack thereof, and other related issues as well. Let's take a break. We'll see you after this with sports.